I'm Dr. Ramdeep Rai. I head the liver transplant program. I was earlier at Apollo Delhi, Gurgaon, and then I started in the last 4-5 years. I have a cancer, for example, if I have a colon cancer, or if I have a prostate cancer, or if I have a papillary carcinoma of the thyroid gland, and if it's picked up at the right stage, then most probably I will never die of that cancer. I may die of other things. I will go on to lead normal lives. But a stage 4 cancer sometimes can be very bad. So the responsibility that I have, that every person has, is because we have access to internet, we have access to media, we know there is something called cancer. We know everyone is telling that you have to pick up cancer at the early stage. So when someone is having certain symptoms, for example, patient is having a lump anywhere, a swelling, patient is having a patch, a new area inside the mouth, on the face, on the skin. If someone is having bleeding in stool or vomiting of blood, there was one patient who I saw today. She's completely okay. But what she said was, she went out. I had completed my prescription. She went out and then came back and said, "Doctor, one thing I forgot to tell you. My weight was 75 kilos in December and it is now 67 kilos. I have lost 8 kilos of weight. Are you sure?" She said, "Yes, my clothes have become loose." So there is a clear proof that she has lost weight. And immediately I wrote out a number of tests, because unexplained weight loss, I'm not dieting, I'm not trying to lose weight, and my weight is going down and down, that must be investigated. If someone is having constipation always for many years, and that person suddenly has diarrhea, repeated, going to the toilet again and again, this is called a change of bowel habit. Or someone who goes to the loo, to the toilet 2 to 3 times, passes stool 2 to 3 times, many years, and says, "Now suddenly I have constipation." We are worried this may be a cancer of the colon or the rectum.
Treatment is complex, as I mentioned earlier. Patient will require 10 hours surgery, 8 hours surgery. Patient will require radiation. Patient will require chemotherapy. Even after such complex treatment, prognosis will be bad, maybe 50% or 60%. But still, head and neck cancer, even with advanced stage, treatment is possible, and still that will be 50 to 60%. So now our goal of cancer treatment is not curing the disease. Cure is obviously the most important goal for head and neck cancer treatment or any cancer treatment. But apart from cure, patient should also have good quality of life. Patient speech should be preserved, patient swallowing function should be preserved, or patient should have access to good rehabilitation services, good dental services. So all these factors are important.
Prangnam Ada Raju.
Salam nono riba.
Tarode namin sulinga ma.
Namen sulinga ba?
Ang na jani resun ko nat kubo.
Monat ken.
Ada. Ira meta ko merong sa.
No. Yade plus F ni nisan tunggu pa. 45 merong sa.
45 tunggu pa merong? Di pa ada. 45 merong aro ramram man ko pa merong ra dengdang ma. Nara phangna ramram man ko pa merong ko sa phala chimba.
No. Anching salgum ko je ko ba chaya. Anchingni anching baljo kanisa pangchaka. Dau wian iran dake maya gemakchi anchingara tik somai kata maningama. Tik somai kata manjagen chim ode anemia mani de anchi bulgriani night blindness andaken walo nakna mangija pa sabisirang na badonga.
Ada ya gemakara 45 merong baksara mai baktong para.
Rani khangani donga no. Anchingni salan thiu cha anio pe na banganam kinirangko jekai iron, folic acid, vitamin B12, iodine, zinc, vitamin A aru D managta amja. Jeni kemenan dakba sabisi unaba donga. Sorkari ansing baljokani kurai makrakata. Tao FSSAI onani kita merong, ata, kari, dud, aru mungsongpa thorango. beena namgunirangko daude chimunge palskageno. Jechin naa salgamako latchiba 10% beena singbaljokanirko mananggen. Yako nagana 45 ko chaimung masibo. Yako anching altuain plus F ni nisanko nakemuna masyayen.
Andi ba ada plus 8 tongga ba reson chingara bauni ko mangen.
Nono yano. Unigamanan sorkario reson scheme rango jekai ICDS, MDM, PDS magsungani yarango pangchakani jechin mungsa centrally sponsored rice scheme ni mananigta fortified rice bisa okodongba magaparang ba chini beena namgani rangni gaman resoni dokano manani ranggata nasmang gemuk nan sokatangiya taloni nasmakna aro anching sakan tini noktang rangna mangmang 45 mirong
Katade nangnin kake donga ada.
Yako Uwyatengpa, Commissionerate of Food Safety, Meghalaya.